Hi, this is Dr. Sunshine, and this is a little quick newscast for our members. We're in the throes of influenza season, and we're seeing surges in COVID. Um, it's not too late to get your influenza vaccine. Right now, the influenza vaccine for most of us is a trivalent, meaning it's got three different vaccines in one. Two of them are against influenza A, the H1N1, and one's for vaccine against influenza B. It does reduce the severity of the illness if you get the vaccine. It can reduce the risk of hospitalizations. It has been shown to be about 35% effective in preventing influenza-associated hospitalizations. So you may know people, friends or family that have been hospitalized for influenza or COVID for that matter. So again, the people that are the most vulnerable are going to be young children, pregnant women, older adults, and those with chronic medical conditions. Other ways to prevent transmission, again, is staying home if you develop symptoms. There is a over-the-counter test kit that you can get. Most pharmacies carry this. It's iHealth. It's a 3-in-1, and it checks for influenza A, B, and SARS-CoV-2. So you can get 6 packs of these, or 2 packs, or 4 packs. You might just have some at home. We have limited supply. But ideally, if you're sick, you want to test. If you're negative for influenza and COVID, but you suspect COVID, you can always retest for COVID in a couple days. The next thing, again, if you're experiencing flu-like symptoms and you test positive, please let us know. Or if you test positive for COVID, let us know. There are medications that can be used that might reduce the duration of the illness and may improve symptoms. The second thing I was going to talk about is the Norovirus, which is causing gastroenteritis across the country. This was kind of a surge that we saw last month in December, and it can be from close contact with other people who have the norovirus. Symptoms are typically sudden onset of nausea, vomiting, and diarrhea. It can last several days. Usually people are feeling better within a few days, but if you do develop symptoms like this, please call us. We can call in medication to help with the nausea. The key is making sure you're hydrated. Try to stay hydrated. If you throw up, usually you don't want to take anything by mouth for a couple hours and then small sips. And really, it's things like Gatorade or Pedialyte or just tap water or fresh water. Food safety. So you want to properly wash fruits, vegetables, and ensure that the shellfish you're getting is cooked. And then disinfecting surfaces if somebody does come down with these symptoms, making sure you're wiping down countertops and bathrooms. Again, there's no specific treatment for the norovirus. It's just hydration, rest, staying at home. But again, call us. And if you're not able to take anything down in terms of liquids for more than 24 hours, you got to let us know, or seeking help in an emergency department to get IV hydration if you can't keep anything down more than 24 hours. That's it. So again, if you have any questions, please don't hesitate to call us, OC Sports and Wellness.